The mission for Circular Genomics is to empower patients with depression, bipolar disease, Alzheimer's, and other neurological disorders with precision medicine tools to better manage their disease and prognosis, doing so with circular RNA biomarkers, and thereby radically transforming care and providing hope for themselves and their families. RNA research broadly helps us to understand the underlying mechanisms behind mental health and neurological disorders. Circular RNA, which is our biomarker platform, is uniquely positioned as a biomarker to contribute to the RNA field in general. A couple of aspects of circular RNA lend themselves to it being really a valuable window into the brain from the blood. We can improve outcomes from the current low standard of care in mental health and Alzheimer's, because across all of neurobiology, we really need to have an understanding of when did that disease process begin.
We are harnessing the power of brain-derived biomarkers to be able to have a really indirect but effective window into the brain and the processes within the brain that are relative for psychiatric and neurological disorders. One of the biggest challenges that we have for developing biomarkers for brain disorders is that the blood-brain barrier that is there to protect our brain from toxins and pathogens at the same time is locking the brain and its secrets inside. So a lot of the molecules that are produced in the brain, they are not able to cross the blood-brain barrier and be detectable in the periphery. This is where circRNAs come in. We realize that these molecules are really enriched into the brain, much more highly expressed in the brain than any other tissue, but they're also highly stable, and they're able to both cross the blood-brain barrier and escape into the periphery. And because of their heightened stability, they can be detected in the blood for days and weeks. So for the first time, there's a biomarker that is coming from the brain and is sensitive to brain processes and neuronal activity, but is able to escape the barrier. So this is mainly our highly innovative technology that we focus on.
MindLight is a simple blood test, the first of its kind really, that allows us to measure circular RNA in blood, which is a brain-derived biomarker, and will allow us to predict whether a patient has high likelihood or low likelihood to respond to SSRIs. The levels of these circRNAs are directly linked to the pathways of serotonin and BDNF. Those are extremely important pathways that typically regulates, whether upwards or downwards, how we feel. And so by allowing us to measure biomarkers that are directly linked to the pathways of serotonin, we're able to better have an idea about who's going to respond to SSRIs and who's not going to be responding to SSRI. And that's in, I would say, in summary, how the test works and why we believe it's extremely critical, because we're able to, for the first time, measure blood biomarkers that are derived from the brain.
The current excitement is that this is a simple blood test that can be used for treatment selection so that we can avoid the normal trial and error process and improve our hit rate with the right treatment for the right patient at the right time. Over time, this test has the potential to be able to actually be used to differentiate between unipolar depression, bipolar depression, between depression and other anxiety disorders.
Here in Circular Genomics, we are innovators and we're doing diagnostics. So therefore, our goal is to bridge the gap between research and practical application. So using circRNAs as our biomarkers, we have developed MindLight, which is an antidepressant response test for SSRIs. However, using technology, we would like to expand our platform and have other categories of antidepressants, but also use these molecules, circRNAs, as a blood biomarker for other neurological disorders such as Alzheimer's. In addition, right now we are trying to develop a kit that will be capillary blood-based blood test, and this it's more direct to consumer, and also it's more convenient and accessible to the patient. So by detecting circRNAs, we can, because we have a PCR assay for SSRIs. We would like to expand our platform for other antidepressants as well, but also expand in neurological disorders such as Alzheimer's. And as I said, we would like to develop a capillary blood-based kit because it's more direct to the patient.
Actually, I'm excited about circular genomics' potential to revolutionize the way we diagnose and treat neuropsychiatric disorders. Circular genomics technology is therefore like a snapshot of the circular RNA signature, and it can be used to develop the first brain signal-derived diagnostic and prognostic tests for many brain pathologies, which is a big unmet medical need.
I think for the future of the company, you can see an increase in earlier diagnosis based upon circular RNA biomarker tools. We will bring to market prognostic tools, therapy monitoring tools, and therapeutics that really deliver the age of precision psychiatry.